Today, we are very delighted to have Dr. Amna Amir Khan as the speaker of the webinar. So, Dr. Amna is an accomplished professional with over a decade of experience in the research and academic. She's currently serving as associate professor and postgraduate program director at Jaldeen Hospital, University Hospital. She has driven by passion of research, and she has made significant contributions to the field of physiotherapy through research and academic. So without any further delay, let's have Dr. Amna to start a presentation. Thank you so much, Dr. Amna, for your time and for your commitment to research and academics.
Thank you so much, Zainab. I hope everybody can hear us because I cannot see the chat box. So if you guys can have thumbs up in the chat box that you guys can hear me and Zainab can tell me.
Yes, we can hear you.
Okay, perfect. So before when we were planning and I had a discussion with Amir that what should we plan with research, and everybody knows synopsis, and everybody is really interested in knowing about research and evidence, and we have a lot of clinicians going on. That is where something clicked my mind, and I said, okay, we have a lot of research webinars that are going on, but we never have a research rumble. So, and before we proceed on, I would like to introduce Research Rumble to you. So, actually, this is a Research Rumble. And what it is a Research Rumble is actually a collective or collaborative event where we all researchers and teams and clinicians and academicians, we all gather together. We want to present our work. And the most important thing in that research rumble is we want to get engaged. That is where we thought of going into a rumble again. So let's come back to what our aim and what do we want to do. But before proceeding that, Ushna would be launching a poll for you. And in that poll, what I would request is if you are a clinician or if you as a student want to become a clinician, please mark 1 in that poll. And if you are an academician or you want to enter academics, please mark 2. And if you want to do both, then I would request, or if you are doing both, then I would request to please mark 3. Ushna, can you please proceed? And Zainab would tell the results for it. So, and
So
Ushna, when you've
we have already
generated the, and
Please
Ushna,
mark on the poll. It's in the chat box. It's live in the chat box.
uh, everyone should poll rather than writing it on the chat. You should poll it. I hope everyone can see the poll. Please go to your chat box and just vote. Don't type the answer.
I think we should take another 30 seconds for it.
Yes. So, Dr. Amna, can we start?
Yeah, sure, please.
Okay.
I'm
So
just waiting.
we have okay. So 63% of the participants are both. They are clinicians as well as academicians, and 20% of them are clinician and academician, respectively. So we have huge number of people who are doing clinics as well as academic.
That's a very great news, Zainab, because if we have people who are actually doing both, that means that they can do research and practice and go implement it on their patients. It's an excellent approach to become an academician and a clinician both at the same time. So let's be little humorous. So have you guys ever wondered what's a conference dance? How many of you have actually attended conferences? I mean, one we recently had the knee conference. So, how many of you actually attended the conference? Then I'm sorry, you need to do me the honors. I think I'm assuming that people are would be saying a number of them. Have you ever seen when you have attended the conference, people are always jumping from one room to the other. They want to grasp all the best of their knowledge that they have. And when you have you ever thought that when you are doing any analysis or when you are actually doing any research, the most difficult part is that analysis that you are doing, or if you have become or you've exceeded that analysis part and you've attended the conferences, when you go and become a reviewer, you always have two reviewers. One always says, oh wow, superb, you have done a good job, whereas the other one says, you even don't know how to spell a word. This is what actually happens, and this is reality. This is where our academic writing or your own research paper comes into place. So you're actually doing a lot of research, you're taking a lot of evidences, but you end up in a mess because you do not know that which evidence is correct or which evidence is good and which evidence is bad. Why? Because you are both clinicians and academicians. So at that time I did not know that what percentage would we have in the poll. So I thought of place an element for all the clinicians. We wanted to see how many of you are actually utilizing the research or what does the literature say. So recently, in the Nursing Association, they have made it mandatory for them to use evidence based practices. But the problems and the consequences that they're facing are their busy schedules and time constraints and the resources. Whereas when we talk about American Medical Association, according to them, the healthcare professionals are using, they are transforming. There is a drastic change from 1990s to 2000 when Second et al. Actually presented evidence-based practice to till date where we have a drastic change in the research.
Difference between literature gap or rationale. I think the Sania
Okay,
has.
rational. Okay. See, literature gap is that is what you're identifying in what is not available, and rational is your purpose of study. So what is the purpose of the study? You, from the literature gap, you can identify your rationale. It is absolutely not issue, but it is not necessary that you always have a literature gap. Literature gap means ये चीज मौजूद नहीं है literature में, तो ये हमें इस पे काम करना चाहिए. But it doesn't matter या इट डजेंट मीन कि आप हमेशा उस लिटरेचर गैप से ही अपना रैशनल निकालेंगे. हाँ, मोस्टली आप अपना रैशनल वहीं से निकालते हैं क्योंकि जो चीज नहीं है उसमें नोवेल्टी आना बहुत जरूरी है, यानी इट इज नॉट अवेलेबल. So that is where you need to give your rationale or the purpose or the maqsad that why you are doing the study. Anything
Well,
else?
I think Amna, we have to let it go now. Thank you very much for that. Thank you, Zainab. Thank you very much
Thank you
for
so much.
facilitating so
Thank you so
nicely
much.
throughout the session. I must say
Thank
that
you.
Both of you have done a brilliant job, and thank you very much for taking the time to explain the people the value of the research and the value of the research in the physiotherapy and the rehabilitation. This side of us is really, really lacking at the moment, and we need to really look into that how we can promote the research so the people like me, yourself, like Amna, like Zainab, both of you have done absolutely fantastic job in the field of the research, and I sometimes admire myself. If I wouldn't be a clinician, I would be a researcher like you. But again, like I said, that you guys are really on top of the research. Anything that I need from me, I always come to you, both of you. So thank you very much once again,
Thank you so much.
both of you, and really appreciate. So this is a recorded program. So what we normally do is that if the members of our sports and musculoskeletal society, they will be having a full access of this conversation or this presentation, but the people who are not the member, they would have a short version of it, so we kind of edit it and make it simple for them. They will still be able to access it, but again, like I said, that if they are member, they will be able to have a full access.
That's it from my side. Thank you.